Hi everyone. Thank you for tuning in to the fall lecture series hosted by the Emotional Health CBT Clinic, and for this particular presentation on depression and its treatment. My name is Ariel, and I'm an intern at the clinic and a PhD student in clinical psychology at Concordia University. This presentation will involve two parts. In the first part, I'll describe depression, and in the second part, I'll present the main elements of one of the most common treatment approaches to depression, cognitive behavioral therapy, also known as CBT. Before describing depression, it can be helpful to distinguish it from the sadness that we all experience from time to time. Sadness is a universal emotion that can be triggered by the loss of something or someone, a disappointment, as something going wrong, or failing to get something we want. Like all emotions, it tells us something about a situation and can help us decide how to respond. For instance, in the example of a breakup, sadness can tell us how much we valued the relationship and how much we wanted it to continue. It can also lead us to think about what went wrong and what can be done differently next time for a relationship to succeed. These feelings of sadness can last hours or days, and people may cope and try to make themselves feel better by talking to someone, by trying to distract themselves, or by simply experiencing the sadness and letting it pass. In some, the emotion serves an adaptive purpose in our lives. In some cases, emotions can become disruptive to our lives, in some cases. In depression, these feelings of sadness can interfere with our ability to experience pleasure, to interact with people, or to participate in life. It can last for months or years. If you or someone you know has experienced depression, you're not alone. According to US statistics, at any given time, 10% of American adults are experiencing depression. 15% of American adults will experience at least one episode of major depression at some point in their lives. While both men and women experience depression, twice as many women seem to experience depression than men. And it's not uncommon for anxiety to be experienced alongside of a depression. There's a lot of variability in the experiences that you or others may have had when depressed, in terms of the combinations of symptoms experienced, the number of symptoms, the severity, and their duration. But all of these experiences, no matter how diverse, are all part of depression. I'll now describe some of the common symptoms that people who have experienced depression describe. If you've experienced major depression, you may have noticed certain moods, physical sensations, thoughts, and behaviors. When people feel depressed, they often describe a low mood that can include a sadness, strong sensations of guilt, and even irritability. They notice sensations of fatigue and changes in sleep or eating. Changes in sleep can include difficulty sleeping or sleeping much more than you may have when prior to the depression. Many people, when experiencing depression, notice changes in eating that cause significant weight gain or weight loss, even though there's no intentional dieting going on. Depression is also linked to certain patterns of thinking that are part of the depression, but also maintain the depression. These include negative thoughts about oneself, about life, and about the future. Negative thoughts that people might have about themselves often have underlying themes of being worthless, unlovable, or no good. These thoughts are common in depression and contribute to the maintenance of the depression by promoting low self-esteem, low self-confidence, and in turn can make motivation to try things to feel better very difficult. When experiencing depression, it can feel like the world is being viewed with glasses that have a negative tint. Events can be viewed and interpreted in a way that's different than how they might be interpreted when someone isn't feeling depressed. For example, hearing a colleague speaking may more likely be interpreted as the colleague being critical when you're feeling depressed than when you're not feeling depressed. Not only can current experiences be interpreted in a negative light when viewed through the lens of depression, but our memory can be affected as well. When depressed, we pay more attention to the negative things that happen in a day rather than the positive ones, and we tend to remember these negative events much more vividly than we do the positive ones. For example, if you or someone you know has been depressed, it could be common to focus, for example, on the 2 out of 10 chores that you didn't get done today, rather than the 8 on 10 that you did. And this is an example of the focus that can go on during depression that is quite common. When depressed, it's common to imagine the future as being very negative as well. The feeling of hopelessness is often described during episodes of depression. The feeling of anticipating that events will inevitably turn out negatively. Examples of these kinds of predictions can include thoughts like, I'll mess it up, nobody will like me, I won't be good at it, the depression will never end, or there's no use in trying, things will not get better. It can lead people to believe that problems can't be solved, that there is no way out of the depression, and in most extreme form can lead to thoughts about suicide. If you've had experiences with depression, you may have noticed low levels of motivation, or that interest in things that you've been interested in before is no longer there. It can be difficult to get started on things, to concentrate, to make decisions. It's common for individuals to do fewer activities when depressed because of how difficult the symptoms of depression make it, and in consequence withdraw from their daily activities and from other people. And this can also contribute to the low mood that forms such a big part of depression. An episode of major depression is described as involving 5 or more of these kinds of symptoms of depression for 2 weeks or more. Depression can be described as mild, moderate, or severe, depending on the number and severity of symptoms, as well as on their impact on an individual. In a mild episode of depression, individuals suffer and experience little joy from life. However, despite difficulty, are able to maintain function in most areas of life. If you have experienced a moderate episode of depression, you may have noticed impacts on functioning in social or occupational situations due to the symptoms of depression, like difficulties concentrating or difficulties with motivation. In an episode of severe depression, these symptoms can make it extremely difficult to function when it comes to things like getting out of bed or getting dressed. A similar but distinct form of depression as compared to major depression is dysthymia. This form of depression is described as a persistent sadness or feeling down in the dumps. Individuals who have experienced dysthymia can also experience symptoms of low energy, low self-esteem, irritability, guilt, poor concentration, similar to major depression. But the difference is that with dysthymia, the depression is usually less impacting on functioning than major depression. However, it's much more chronic. Impacting people's lives on the scale of years. Because the low mood has been present for such a long period of time, for people who experience dysthymia, that many people do not seek treatment for it, believing it's simply part of their nature, that it's something unchangeable. People who experience dysthymia are unfortunately at a higher risk of experiencing an episode of major depression than people who have not experienced dysthymia. Now I'll speak a little bit about the causes of depression. Now, the cause of depression is complex and related to a multitude of combinations of factors that differ from person to person. These factors can include someone's biology, personality traits, life history, current life situation, recent stressful life events, and patterns of thinking, to name a few. For some individuals, depression can follow a stressful life event. This event could include the breakdown of a relationship, social isolation, the loss of a job, or it can be less specific, like a general uncertainty about the purpose of one's life. The risk for depression increases with the number of stressful life events occurring simultaneously in one's life, or one after another within a certain window of time. There are factors, however, that provide resiliency against stressful life events, and these can include patterns of thinking and one's social support network. A person's biological makeup seems to play a role in the experience of depression. What we see is that depression often runs in families. That being said, however, not all children of parents who suffered from depression will go on to experience depression themselves later on in life. And some people who do develop depression have no family history of it at all, meaning that there are other factors that are at play in the development of depression that are not biology. The connection between depression and the brain and body is highly complex and not yet fully understood by researchers. What we do know is that depression can be linked with abnormalities in the delivery of neurotransmitters. These are chemical messengers in the brain. It seems like these abnormalities might be involved in both the lead up to depression, but also a product of the depression, as the experience of depression itself can influence the brain. The good news, however, is that while depression can affect the brain, so can treatment. In the second part of the presentation, I'll outline one of the most common treatments for depression. So one of the most effective treatment strategies for depression is cognitive behavioral therapy, also known as CBT, which will be the focus of this portion of the presentation. Research suggests that CBT is quite effective for depression. In fact, when studied in combination with medication, CBT caused better results and lower risk of future episodes of depression among people receiving both CBT and medication than individuals receiving medication alone. The tools and strategies that individuals can pick up seem to be quite effective in managing and preventing depression. CBT can help people experiencing depression by helping them develop skills to identify and modify the thoughts and behaviors that maintain depression. As I mentioned earlier, thought processes that are common in depression include a tendency to notice, remember, and interpret events in a more negative light. These patterns of thinking occur because of the depression, but also take part in a cycle that makes people feel even worse. For example, if you were to invite 3 people to lunch and one didn't show up, someone is more likely to think something like, "No one likes me," if they're feeling depressed at the time, compared to at a time where they're not depressed, where they might think something else, like, "Most people like me, and maybe this person who didn't join us for lunch might have had other plans." The first interpretation of this situation occurred during a depression. However, the thought itself might worsen the depression by promoting feelings of helplessness and hopelessness. Managing depression will involve helping you identify, test, and maybe change negative thoughts by reviewing all the information in your environment, not just the negative aspects of a situation, but the neutral and positive ones too. This more balanced, the skill of practicing balanced thinking can help prevent thoughts that elicit low mood. One skill taught in therapy for depression is disputing depressive thinking. The goal is to challenge the aspects of thinking that are negatively distorted because of depression's tinted glasses. These distortions can include taking a negative outcome that happened in a couple of experiences and generalizing them to all situations. It can include predicting catastrophe. It can include blaming oneself for things that are not your fault, to name a couple of common distortions that depression causes and that worsen depression. These distortions might feel completely true when you're experiencing depression, and they further contribute to these feelings by leading to global perceptions that everything is bad and hopeless, and that nothing will improve. What can be helpful if you're experiencing depression is examining these negative thoughts and identifying the potential negative twists in the thinking. Questions that can help you with this examination can include, am I focusing on my weaknesses and ignoring my strengths? Am I generalizing based on only a few experiences? Once a negative thought has been identified, the thought can then be evaluated. Some helpful questions to guide you can include, what are the facts of the situation? And what are my subjective perceptions? What evidence supports this perception? And what evidence might contradict this perception? What's an alternative, more balanced view of the situation? In most cases, this new balanced view is less negative than the original thought and is less likely to contribute to a further descent into the experience of depression. Now, I'll be speaking about some strategies for treating depression that involve actions. As I mentioned earlier, if you were to track your daily activities and feelings of depression over time, you might notice that when you are depressed, you are also less active. Depression drains the energy of people who are experiencing it and can make people feel as though things are hopeless. This can make doing things very difficult. Difficulty doing things then reinforces the sense that things are hopeless and cannot change, and therefore perpetuates the feelings of depression. An important step in treating depression is breaking that cycle and increasing the number of activities that are done in a day. More specifically, we want to increase the number of activities engaged in, and specifically the kinds of activities that brings a sense of pleasure and achievement. These kinds of activities are the biggest mood boosters and are connected to what we value most and promote an approach rather than an avoidance of life's challenges. The first step in this process involves recording your activities and tracking your mood in order to uncover the links between each other. The next step involves scheduling activities in your week as a way of increasing activity levels. Engaging in activities like physical exercise, listening to music, or talking to a friend can have direct effects on mood and can progressively help people feel better. It can also have indirect effects on mood by influencing your thoughts. For one, focusing on an activity can provide reprieve from the focus on negative thoughts that is quite strong during a depression. In addition, they can challenge some of the negative beliefs that commonly occur during a depression. For example, cleaning out a cupboard can help challenge the belief that we are useless, or talking with a friend can challenge the belief that no one cares about us. Activities are gradually reincorporated into daily life using a daily activity schedule. These schedules provide structure, can serve as motivation for staying active, and can provide a sense of personal control that comes from finding yourself able to do some of the things that you had planned. There are many templates that are widely available to use for this daily planning, but in essence, it's a schedule of what you intend to do each day. Some people will fill it out each evening for the next day. A tip when it comes to planning a daily activity schedule can be to begin by planning easy lead-in activities that can motivate us to get out of bed and to help build a sense self-confidence in one's capabilities by starting off with activities that might be easier to complete. It's important within these daily activity schedules to include activities that provide a sense of pleasure and some that provide a sense of achievement. And these are always personalized to where each person is at a certain point in time. For example, taking a shower can be a major achievement when we are feeling very low. Another important part of activity scheduling is at the end of the day to go back and reflect on the schedule, noting down which activities were done, and to rate out of 10 the level of pleasure and achievement that each activity provided. And this is important because the information provided through these ratings can help us identify which activities felt good and which which activities can be good ones to schedule again to improve mood. Another strategy used to help cope with depression is problem solving. And this can help individuals make the changes they would like to see in their lives. Periods of depression can emerge from a particular set of difficult circumstances, like the loss of a relationship, a job, or more general factors like loneliness, poor self-esteem, or absence of purpose. Therefore, when treating depression, it's important not only to address the thoughts and behaviors that might maintain depression, but also the problems that contributed to the depression. The first step is identifying the list of specific problems that you might be currently facing. This can be helpful in and of itself by helping create some order in what is often experienced as chaos during an episode of depression. If you've experienced depression, it can likely feel like there is a mass of distressing experiences, and by creating a list, it can disentangle this mass into a smaller number of specific problems. In order for problem solving to be effective, the problem defined must be specific. For example, a statement like, "I feel financially insecure," can feel like a more manageable issue to tackle and be easier to address than a more vague statement like, "I feel like a mess." After the problems have been identified, problem solving can begin. This can involve brainstorming potential solutions to a problem and identifying which might be more feasible to carry out. If you are experiencing depression, it can often be difficult to access our creativity in terms of potential solutions. Therefore, it's quite common, and it can be very helpful to ask others that you trust for input on potential ideas of problem-solving solutions. When focusing on the aspects of situations that can be changed, identifying a plan of change, and completing the actions needed to improve the situation, this can make us feel significantly better. On the one hand, by providing us a sense of personal control over our lives, as well as actively exerting change in our environment. Next, I'll talk about the use of social support as a way to manage depression. Supportive relationships are very important for physical and mental health. In fact, they're one of the best buffers against depression. These relationships provide us with emotional support, practical help, and information, a different perspective on our problems, a sense of personal worth and belonging, as well as ideas for problem solving. If you've ever felt depressed, you might have felt alone, however, felt a sense of heaviness that could make communicating with others very difficult. You may have felt like you had nothing to offer others and therefore withdraw from others as a protective measure. While this often feels like the safest thing to do when we're experiencing depression, it can lead us to feel worse in the long run. Therefore, treating depression can involve identifying how to make the most of your social support network. Letting others know that you're struggling can be a big step. It can relieve some of the pressure that is very much present for many people who experience depression, and it can help garner support from others that you may not have expected. It can be helpful to let others know how they can best support you in your time of need, while also taking into account their limits. Combining social interaction with an activity can also be helpful. It can provide an opportunity to enjoy the company of others and reprieve from the thoughts and difficulties that are so very present in depression. If you have experienced depression, treatment would involve not only strategies to manage the episode of depression you are in, but importantly also involves creating a lifestyle that can minimize the risk of depression coming back and building tools and strategies to respond to signs of depression the moment they appear. Having an activity or activities that are satisfying and meaningful to us are protective against depression. As a way of building up resiliency to prevent future depression, we can help individuals explore potential interests, and with time, engaging in what's interesting to us can help develop passions and provide a sense of fulfillment the more they're pursued. They can be creative pursuits, learning experiences, group activities, whatever is of interest and speaks to the individual. Further, doing physical exercise like walking, jogging, or sports regularly can enhance mood and help maintain well-being. Developing resources to help cope with negative life events is also an important part to protecting yourself from depression. Resources include adaptive thinking skills like the ones covered here, self-esteem, communication skills, social support, and interests that provide a sense of pleasure and achievement. Goal setting can be an important tool for providing continued structure in our lives and helping us achieve what we want. This can help provide a sense of purpose, and which can buffer against depression, and it can also help us feel a sense of control and a decreased sense of helplessness that often can be a precursor to depression. The most effective goals are the ones that are measurable, are realistic, to complete in order to help foster a sense of achievement once they are accomplished. So the more measurable they are and the more specific, the easier they are to identify when they have been completed, and the easier they are to be accomplished. For example, a goal of going to see a movie on Friday night is easier to measure and work towards versus more vague goals, more vague goals. To close out this portion of the presentation on the treatment of depression, there are a few important considerations to note. For one, it's completely normal that identifying and working with thoughts that changing behaviors are difficult at first. And it's important to try not to be discouraged or self-critical about this difficulty. For example, when it comes to activity scheduling, it's normal to not feel like doing the scheduled activities at first. Motivation often follows doing something rather than coming before. If it's hard to do an activity, it can be helpful doing it partially, even just for a few minutes. It's crucial to not be discouraged or critical if some activities are skipped. They can always be rescheduled. The goal is to increase activity progressively, and the activities will become easier over time. It's also important to know that it's completely normal that trying out activities that you may have done before your depression may not feel as enjoyable or satisfying as they used to be. Disappointment about this can often lead to deeper feelings of depression and lead us to feeling worse. Acceptance of the difficulties that come at first when working on these strategies can be helpful, and acknowledging that with practice, finding pleasurable elements of experiences, no matter how small, is possible. Over time, it will be easier to experience positive moods. And this concludes today's presentation on depression and its treatment. Please know that this presentation will be continued live on October 7th at 7:30 p.m. On our Facebook page, where I'll be providing a summary of this presentation, and then we'll be opening the floor for a Q&A question and answer period. I look forward to seeing you all there, and in the meantime, take care.